This short video has been produced by the Dublin Dental University Hospital to demonstrate the steps involved in the reprocessing of reusable invasive medical devices, or RIMD, for their reuse in a dental practice. These steps also apply to the decontamination of all RIMD in primary care local decontamination units, including general practice and podiatry services. Decontamination and sterilisation processes are based on the Health Service Executive Standards and recommended practices for decontamination of RIMD in a local decontamination unit. All dental practices that provide services for the HSE must meet these minimum standards. The Health Information and Quality Authority, HIQA, has developed national standards for safer, better healthcare to describe what is required of a high-quality, safe service. HIQA require healthcare providers to have structured systems in place. These national standards were developed to control and minimise the risk of infection to patients and staff. Improving the quality of care and providing a safe working environment are fundamental activities for the HSE. One of the key factors in ensuring quality standards in a healthcare environment is the reprocessing of RIMD. Decontamination involves a combination of specific processes used to render RIMD safe for handling by staff and for subsequent use on patients. Effective decontamination of RIMD is an essential component in the prevention of healthcare-associated infection. It is critical that site-specific operational procedures are developed for each zone of the local decontamination unit, or LDU. This should consist of a combination of the HSE standards and recommended practices and manufacturers' instructions. These procedures are essential to ensure quality control, efficiency and to reduce system variation. The process of decontamination consists of three principal components. These are cleaning, disinfection and sterilisation. Cleaning physically removes soil or debris from RIMD, including large numbers of microorganisms and the organic material they consume as a source of food and energy. Disinfection causes a significant reduction in the number of viable or living microorganisms on inanimate objects, but is not as effective at reducing the density of and killing of bacterial and fungal spores. Sterilisation refers to a physical or chemical process that completely destroys all forms of viable microorganisms from an object, including spores. The decontamination life cycle highlights the extent to which decontamination affects the organisation of the entire dental facility and not just the areas where RIMD are processed. Once RIMD come in contact with blood, bone, saliva and human tissue, they become contaminated. The decontamination life cycle process must be followed before the RIMD are used. This is the sequence that all contaminated RIMD in the dental surgery are required to follow after the RIMD have been used on patients. Effective decontamination requires the attainment of acceptable standards at all stages of the life cycle. Failure at any stage may result in inadequate decontamination. The 10 steps of the decontamination life cycle for RIMD are 1. Acquiring a medical device. 2. Cleaning. 3. Disinfection. 4. Inspection. 5. Packaging. 6. Sterilisation. 7. Transport. 8. Storage. 9. Use. And 10. Transport. The Local Decontamination Unit, or LDU, of the Dublin Dental University Hospital was designed and constructed according to the HSE standards and recommended practices for decontamination of RIMD in a local decontamination unit. The floor plan of the LDU highlights the locations of the traffic light flow system, beginning with the red zone, then the amber zone, and finally the green zone. In order to achieve the 10 steps of the decontamination life cycle, it is best to design the local decontamination unit with zones similar to a traffic light flow system. The first zone is the red zone. This zone is the first point of contact in the LDU for reusable invasive medical devices, i.e. dental instruments, after they've been used on the patient. This is the most contaminated zone of all 3 zones. The next zone is the amber zone. Here instruments have been thermally disinfected but are not sterile. This zone should only be used to inspect, pack and prepare instruments for sterilisation. The last zone is the green zone. This is the zone from where instruments are released following steam sterilisation in an autoclave to the storage area before being used on a patient. In this video, we will accompany an appropriately trained dental healthcare worker through the steps of the decontamination life cycle. The first step of the decontamination life cycle is acquiring a medical device. This is the purchasing of the dental instrument. The manufacturer is obliged to provide information on the use, function and the processes to be used for cleaning, sterilisation and, if appropriate, the dismantling of the instrument. Before any device or instrument is purchased, ensure the decontamination process recommended by the manufacturer is compatible with the existing decontamination processes used in the LDU. Ensure all devices have a CE mark. This means that it conforms with European Union standards of safety. Single-use items cannot be sterilised or reused following their first use. Reuse of single-use items compromises the integrity of the device, and if they're used a second time, the product liability for its performance is then transferred from the manufacturer to the dental healthcare worker. The device is no longer fit for the intended purpose, and the user assumes all legal responsibility for any potential adverse effects arising from reuse, and is liable for sanction and/or prosecution under EU and national legislation. Once instruments come in contact with the patient, the dental team or the environment, they are contaminated. After the patient leaves the dental chair, it is the responsibility of the dental healthcare worker to dispose of sharp items before cleaning the area and removing contaminated dental instruments from the dental chair area into a contaminated instrument box. Contaminated RIMD should only be transported to the designated decontamination unit or area in a closed container. This transport container should be lockable, so the lid cannot open accidentally, and should be clearly labelled with a biohazard symbol. The contaminated instrument box is placed in the designated receiving area in the red zone. It's important that the dental healthcare worker carries out hand hygiene according to the World Health Organization My 5 Moments for Hand Hygiene protocol. This sequence includes rubbing hands palm to palm, in between fingers, backs of fingers, thumbs and nails. Full guidance is available on the World Health Organization website. The dental healthcare worker then dries her hands thoroughly with disposable hand towels. Using the hand towel to turn off the taps and then dispose of the hand towel in a domestic waste bin, using a foot-operated pedal to open the bin. The dental healthcare worker puts on personal protective equipment, PPE. The PPE includes a full-length disposable gown, a disposable surgical cap, a full-face visor and disposable non-sterile gloves with extended cuffs. These gloves are Category 2 gloves, which offer a higher level of protection than regular examination gloves commonly used in the dental surgery. This is the required dress code for personnel working in the red zone. A disposable visor is the best option to protect the face from splashes. This PPE should never be worn outside the LDU. The next step in the sequence of decontaminating the RIMD is Step 2, cleaning. The dental healthcare worker turns on the ultrasonic bath, closes the drainage valve, adds the appropriate measure of cleaning agent, for example detergent or enzymatic cleaner, for the machine and fills the ultrasonic bath with water. Follow manufacturer's instructions regarding the type of water and cleaning agents to be used in the ultrasonic bath. This may be tap water or water produced by a reverse osmosis unit. In the LDU, chemicals should be stored in a designated lockable cupboard, which should be clearly labelled. Copies of safety data sheets for all chemical agents used in this area should be readily available. The dental healthcare worker removes kits, kidney dishes and handpieces to the washer disinfector holding area. Burrs and single dental RIMD are placed on the instrument trays ready for the ultrasonic bath. Remember to open any RIMD with a hinge before placement in the ultrasonic bath. Opening the instrument ensures all areas will be cleaned thoroughly and that no parts are shielded or masked from the cleaning process. Do not overload the ultrasonic bath with RIMD. Overloading may result in the inadequate removal of organic material from the RIMD. Handle RIMD carefully to avoid percutaneous injury and use heavy-duty gloves. If any single-use burrs or items are brought into the LDU, these should be disposed of in a sharps container. This ultrasonic bath operates for a total of 6 minutes. The temperature range is a minimum of 20 degrees centigrade and reaches a maximum temperature of 40 degrees centigrade. These are the key parameters for checking the graph and releasing the instruments to the next step of the decontamination life cycle. This ultrasonic bath uses an enzymatic-based solution which helps to break down and loosen organic contaminants from RIMD. The RIMD that are removed from the ultrasonic bath are still contaminated. When the cycle is finished, the dental healthcare worker removes the instrument trays from the ultrasonic bath, then places them on a metal tray to reduce spread of contamination caused by dripping water. The trays containing the RIMD are transferred to the washer disinfector holding area. Step 3 of the life cycle is disinfection. Here the dental healthcare worker prepares and loads the RIMD into the washer disinfector for thermal disinfection. It is important to note that thermal disinfection only occurs when a washer disinfector has been used. The dental healthcare worker opens the washer disinfector and places dental handpieces onto specific adapters provided in the washer disinfector. These are designed to facilitate cleaning and thermal disinfection of the complex internal components and channels of handpieces. Automated thermal disinfection of dental handpieces using a validated protocol with a washer disinfector is the preferred method of dental handpiece decontamination prior to sterilisation. Due to their complex interior design, including the presence of narrow lumens and channels, dental handpieces should preferably be processed through a washer disinfector equipped with dental handpiece adapters, as per the specifications of the manufacturers. New washer disinfectors should have adapters for dental handpieces as standard. If using RIMD cassettes in the clinical area, load the cassettes into the washer disinfector without stacking them on top of each other or overloading them. Ensure there are sufficient gaps or holes in the cassette to allow the water and detergent to clean all the RIMD and internal areas of the cassettes. Use of cassettes is preferable to minimise instrument damage and reduce the risk of percutaneous injury from handling of contaminated RIMD. Single RIMD, for example a Coupland's chisel, should be placed in a metal meshed basket in the washer disinfector. The stages of washer disinfection are as follows. Flushing. This removes gross contamination from RIMD. Washing. Removes any remaining soil. Rinsing. Removes any additives used during the cleaning process. Disinfection. The temperature must reach a minimum of 91 degrees centigrade for 1 minute. Drying. This purges the load and chamber with heated air to remove residual moisture. The manufacturer's instructions will guide you to the type of water and cleaning agent to be used in the washer disinfector. The washer disinfector must have specially treated water supply, such as reverse osmosis generated water. Reverse osmosis, RO, is a technology that uses a semi-permeable membrane to purify water. It does this by removing large particles, including bacteria and many types of dissolved molecules and ions, from the water supply. The purified RO water is collected and can be used directly or stored for future use. Dissolved chemicals and particles present in the original water supply do not pass through the RO membrane. RO technology is commonly used to generate drinking water from seawater. Reverse osmosis water is recommended for the disinfection fill stage of the washer disinfector, as this water has very low levels of dissolved or suspended chemicals and minerals. RO water is usually generated on-site from a reverse osmosis unit. These units are usually equipped with a water reservoir for short-term storage of RO water. Such reservoirs are often equipped with an ultraviolet light treatment system to minimise microbial growth and multiplication. RO units used to provide RO water for autoclaves and washer disinfectors are normally configured to provide sufficient RO water for the daily demands of the equipment with minimal storage time. The quality of the water used at all stages in the cleaning process is critical to the successful outcome of the process, as the water is the last product to make contact with the RIMD prior to its subsequent use. The dental healthcare worker removes their gloves and disposes of them into the appropriate foot-operated healthcare risk waste bin. The dental healthcare worker carries out hand hygiene, dons a new pair of gloves and performs surface cleaning. All areas which have been in contact with a contaminated RIMD must be cleaned and decontaminated. Suitable wipes for decontamination of hard surfaces must comply with appropriate European standards. Effective wipes will kill bacteria, fungi, viruses and spores. Wipe in one direction only and do not cover the same areas twice. The disinfectant wipe must be changed if it becomes dry or heavily soiled. The surface is allowed to air dry. Before moving to the next zone, the dental healthcare worker disposes of all PPE which was worn in the red zone into the healthcare risk waste bin. If wearing protective glasses, these should be removed and disinfected with suitable disinfectant wipes. The dental healthcare worker then carries out hand hygiene. As a minimum, a manual tracking system should be in place to record the progress of RIMD through each stage of the decontamination process and allow retrospective demonstration that a particular cassette or single item RIMD has been correctly decontaminated. By having a tracking system in place, the organisation can prove the sterility of the RIMD which are used for patient treatments. The dental healthcare worker reviews the graph printout produced by the ultrasonic bath and the graph printout of the washer disinfector on completion of the cycles. On completion of the cycle, document the details of the graphs, including the date, time, cycle number, the temperature and the holding time. The graphs must be signed by a person who is suitably trained. The dental healthcare worker then carries out hand hygiene. The dental healthcare worker then dons a new gown and surgical cap. It is recommended in the standards that a residual protein test should be performed as part of the weekly tests to establish the effectiveness of the washer's cleaning process. A residual protein test is carried out on one dental instrument after thermal disinfection in the washer disinfector. This test can detect traces of contaminating proteins present on RIMD after processing through the washer disinfector. The test consists of a swab and a container of reagents. The reagents undergo a colour change in the presence of protein. Select an instrument which has been used during an invasive procedure, for example an extraction forceps. The manufacturer's instructions must be followed. Wear appropriate PPE as directed by the test manufacturer. To carry out a protein test, vigorously swab the RIMD using the test swab, focusing on hinges and crevices that may harbour traces of contamination. Unscrew the cap of the reagent container and swirl the swab in the liquid reagent for approximately 10 seconds. Remove and set aside the swab for discarding in the appropriate waste stream. Visually inspect the liquid reagent for any colour change, as this indicates the presence of residual protein on the RIMD and should be recorded as a failed test. Failure indicates inadequate cleaning, which may be due to low detergent, shadowing of instruments, or a blocked spray arm in the washer disinfector. Ensure all of these are reviewed and corrected before reprocessing the failed load. Ensure that all components of a protein test are disposed of as per the manufacturer's instructions. The dental healthcare worker then carries out hand hygiene. Once the protein test has passed, the dental healthcare worker can then remove the remaining RIMD from the washer disinfector. When dental handpieces are removed from the washer disinfector, they need to be lubricated. The dental handpiece maintenance system is a machine which propels an oil-based lubricant under pressure into dental handpieces. Lubrication is essential to ensure handpieces function correctly. Only use a lubricant recommended by the dental handpiece manufacturer. We are now ready to move on to Step 4, Inspection, and Step 5, Packaging. All RIMD must be inspected prior to packaging. Ensure that there is adequate lighting in the inspection and packaging area. Check that the inside of lumened RIMD, such as high-volume suction tips, are clear. Inspect all other RIMD for debris, rusting, breakage, and hinge fractures. Wrapping or packing a product in one or more layers of packaging ensures that the product will remain sterile after the sterilisation process is complete. Packaging pouches are frequently used for dental RIMD. It is important to place the handle of the instrument into the pouch first. When opening the package for instrument use, the handle is met by the user's hand first, rather than the working end. This can help to avoid a percutaneous injury from sharp instruments. When packing probes and sharp instruments, use tip protectors. This will not only permit safe handling of RIMD for staff, but also protects the sterility of the instruments by preventing puncture of the pouch. As a safety precaution, probes and sharp instruments can be double-bagged if tip protectors are not available. Each sterilisation pouch must be sealed along the perforated line to ensure that the bag is sealed correctly. Packaging of kits involves wrapping kits in a sterilisation wrap sheet. Autoclave tape is used to secure and seal the wrapped kit. The indicator marking on the autoclave tape and/or pouches change colour when exposed to the steam sterilisation process. We are now ready to move on to step number 6. Sterilisation. The autoclave, which is positioned in the green zone of the LDU, is used to sterilise the RIMD after decontamination and packaging. This is achieved by steam sterilisation using a vacuum autoclave. Steam sterilisation is the recommended method of sterilisation in LDUs. There are a number of required tests that must be carried out daily and weekly before using the autoclave. RO water should be plumbed into the autoclave in order for successful sterilisation to take place. The presence of dissolved and/or suspended chemicals in water supplied to sterilisers can result in deposits on materials during the sterilisation process. If the RO water is not plumbed into the autoclave, it can be stored in easily identifiable containers. RO water should be stored in a cool area, away from sunlight and high temperatures. The warm-up cycle of the autoclave is required to be carried out first thing each morning. The warm-up cycle is used to raise the temperature of the autoclave before the tests are carried out. This cycle may be selected from the types of cycles listed on the autoclave. If the autoclave does not offer a warm-up cycle, A warm-up can still be performed by selecting a Bowie and Dick cycle on the autoclave without placing a Bowie and Dick test into the autoclave. If a warm-up cycle is not completed, all subsequent tests will fail. The warm-up cycle graph printout should be signed and documented. When the cycle is complete, it is important to check the graph printout before moving on to the next test. The second test to be completed is the vacuum leak rate test. This test is carried out on a weekly basis to detect air leakage in the autoclave chamber. It is recommended to perform this test on the first working day of the week. Air leaks can result in wet packs, as leaks may affect the drying process. Furthermore, the presence of air in the chamber prevents steam penetration of the load and can prevent sterilisation. The third test to be completed is the Bowie and Dick test, which monitors an even distribution of steam penetration within the autoclave chamber during the cycle. The Bowie and Dick test must be carried out on a daily basis. The test pack is placed on a tray into an empty autoclave, run on a dedicated cycle called a Bowie and Dick cycle that is 134 degrees centigrade for 3.5 minutes. The Bowie and Dick test can signal the presence of non-condensable gases. Inadequate air removal manifests as air pockets in the indicator, showing a failure of the test. Upon completion of the cycle, remove the test pack from the autoclave, open the pack and take out the indicator sheet. The indicator sheet must have changed from a light colour to an even dark colour. If any difference in this colour is noted, repeat the test. Failure may indicate inadequate air or water supply. Review and correct before repeating the Bowie and Dick test. If the second test also fails, it should be recorded as a fail on the indicator sheet, the autoclave log page, and the graph printout should be signed and documented. Do not proceed to the next cycle until a Bowie and Dick test has passed and the graph printout has been signed. Validation is the documented procedure for obtaining, recording and interpreting the results needed to show that a process will consistently yield a product complying with predetermined specifications. The process of validation is to examine all aspects of the decontamination and sterilisation process to determine if they are operating and functioning correctly. An independent engineer test person from an outside organisation is required to service, repair and validate the ultrasonic bath, washer disinfector and autoclave on a regular basis. After each service and validation has taken place, a report is submitted by the company engineer to the customer. It is best practice to check and sign the validation reports prior to storage. It is a legal requirement to maintain and store validation records. If there are any failures of any of the cycles during the daily and weekly testing stage, ensure to report to the practice manager or decontamination lead. It is best practice to record and document all failures as part of the record-keeping files. If any of the daily or weekly tests fail, repeat each test again. If these repeat tests fail, do not use the autoclave. Contact the maintenance engineer to seek further advice. Once all daily and weekly tests have passed, you are now ready to process the RIMD through the autoclave. To do this, you need a tracking gun to label every packed instrument from the amber zone, which will then be placed in the autoclave trays. Ensure that the tracking gun cycle number corresponds with the autoclave cycle number, and that the correct date is also printed on the label. All tracking documentation completed throughout the decontamination cycle must be accompanied by the signature of the person completing the decontamination procedures. Once again, we return to the importance of maintaining a manual tracking system to record the decontamination process used on RIMD, to link them with patients on which they have been used. After loading the autoclave with the labelled RIMD, the dental healthcare worker selects the appropriate cycle for sterilisation, which is 134 degrees centigrade for 3 to 4 minutes. This is the recommended temperature that must be reached in order for sterilisation to be successful. The dental healthcare worker now checks the graph. This is carried out after each cycle is completed in the autoclave. The graph printout is designed to show that the operating cycles are functioning correctly, and therefore sterilisation has been achieved. The graph printout will give a reading of the sterilisation parameters that the autoclave has reached during the cycle. It is critical to ensure that this section of the graph is analysed correctly. The key parameters to be checked are date, cycle number, temperature, and holding time. The sterilisation holding time is the length of time the autoclave has reached and maintained 134 degrees centigrade and is the most important detail on the graph. 3 to 4 minutes at 134 degrees centigrade is required for effective sterilisation. Remember to sign the graph printout after each cycle is complete. Any cycle not meeting the criteria, although indicated as a pass by the automatic controller, should be rejected. The load should be repacked and sterilised, and the steriliser removed from service until the cause of the fault has been established and remedied. A failure of the cycle recording device should also be a cause to reject the sterilisation cycle. When the autoclave has finished the cycle, it is important to use heat-protective and temperature-resistant autoclave gloves, as the autoclave chamber is hot. While removing the sterilisation pouches and kits, the dental healthcare worker inspects all RIMD packs for damage, such as ripping, tearing or pack perforation. If pouches or kits are wet, the RIMD have to be repacked and re-sterilised. Check that the colour indicators have changed. The next step of the life cycle is number 7, transport. The instruments are transported from the autoclave to the storage area. And here we move to step 8, storage. In the storage unit, instruments should be segregated and stored appropriately. Sterile items are to be separated from unsterile wrapped items at all times. Allow instruments time to cool before placement for storage. Sterile dental RIMD should be transported in a manner that will not compromise their status. Remember, contaminated items are to be separated from decontaminated items at all times. Decontaminated items are to be separated from wrapped items for sterilisation. Loss of sterility is event-related, which depends on the extent and nature of handling and environmental conditions during transportation and storage, and the quality of the packaging material. It is important to remember that dental RIMD must be stored at room temperature, must not be exposed to sunlight, must not be stored on the floor, and must not be stored under conditions where they could become wet or damp. The next step of the cycle is number 9, use. This is where dental RIMD are ready to be used. Instrument pouches and kits should only be opened once a patient has presented for dental treatment. Each pouch must be opened using the peel-back technique. The next step of the life cycle is number 10, transport. This is where used RIMD are returned to the local decontamination unit after use to commence the decontamination life cycle process. At the end of the working day, ensure that all graph printouts and related test results from all machines in the LDU are logged and stored so that they can be easily retrieved should they be required. Storage of these records is a requirement of the HSE standards and recommended practices. It is important to remember that each step of the decontamination life cycle is critical to the end product. Failure to adhere to any step in the decontamination life cycle may result in inadequate decontamination of RIMD with the possibility of subsequent infection of patient and practitioner. It is important that each local decontamination unit adheres to the HSE standards and recommended practices required for LDUs and the Dental Council of Ireland's Code of Practice for infection, prevention and control.